One moment, please.
Try a test.
Test. YouTube test.
Yep, good.
We're good?
Yep.
Okay, wonderful. All right, so first of all, we are so excited that report cards went out recently and that we had a very productive first quarter at the schools. We are very, very grateful to everybody in the community for all the wonderful choices and support that you've been to us this year. This has been a year like no other, and we are just so very grateful for what's happened. We had a great football season. Went to the playoffs, didn't do well in the second round of the playoffs, but it was still great to go to the playoffs. Hosted a number of home games. Fans were great. We appreciate your support and understanding. The Belpre, Pride of Belpre marching band, which you were able to enjoy a few minutes of as we began tonight, had a great season, and looking forward to our Belpre cross-country runners competing in the district. I think it's the regionals this weekend, and potentially into the state tournament the week after. So. Great things going, and it was a wonderful first quarter. So to start tonight, I would like to brief everybody and show some information on what we are seeing here in the county. Make sure I got this setting right. Okay, hopefully everybody at home can see this. Lauren, is this my screen popping up?
We're delayed,
okay.
So give me a few seconds
Yep.
to see.
I don't want to start talking about data if we're not showing screen.
Should we see that?
Yep, you're showing up.
Okay, all right, great. So I want to start at a high level, and then I want to zoom in on a more narrow level. For the folks on YouTube, I'm going to try to narrate this for you. If you look, this is the United States case positives per day tracked since the pandemic began. And you can see that within the last 2 weeks or so, we have met our previous highs and at least one day have kind of spiked above it. So at a national level, we're about where we were towards the end of July, mid-July, in terms of cases. Every month, every day, the governor provides this update on coronavirus.ohio.gov, which helps us understand a little bit about what the cases are looking like here at a state level. So if you can see here, we have been averaging 1,900 cases over the past 21 days. And in the last day, we had about 2,500 cases. So on the right side, it will make a graph for you. For folks that haven't been keeping up with this as closely, this number about 3 weeks ago was closer to 1,000 or about 900 for reference. And then it also tracks what our 21-day rolling average is for fatalities across the state, for hospitalizations, and for ICU beds. So just a couple of evaluations on this graph. I think one concern that Governor DeWine has expressed is that this number has almost doubled in 2 weeks. And so that obviously, if hospitalizations continue to increase at that kind of a rate, we could potentially run into an issue where hospital beds aren't available, and which is what we don't want. So that, I think, is a troubling trend that at least at the state level that they have been monitoring. And then ICU admission rates have stayed fairly constant. And from my conversations with Ann Goon, our Director of Public Health, we have not seen a tremendous increase in that, and there's no cause for concern yet as far as bed availability. So this is now zooming in. So we started at the national level, then we went into state level. Now we're looking at number of cases in Washington County since we began the academic year. And so anytime that you see a 1, that represents a new case. And if you don't see anything, that there were no new cases this year. So as you can see, from where we started the first day of school, only up until about a month ago, things were fairly stable at 1 or 2 cases, maybe every other day or so. But there's been a troubling trend in the county, kind of seen towards this end of the graph, where we've started to see more cases in Washington County. I want to make sure that the audience understands, though, that my conversations with Ann Goon, our public health director, the vast majority of those, maybe up 90 to 95% of those cases have been in Marietta. There have been a few cases here in Belpre, and then not much in the outlying county area. So about 90 to 95% of that, in that increase that we've seen in the last month or so in the county, is mostly coming out of the Marietta area. So every Thursday, this is Ohio's Public Health Advisory System. Some of you have heard it about the color map. Every Thursday, Governor DeWine releases this information to let us know what's going on at a state level. And these numbers represent Washington County's numbers. So at this point, we have met 3 indicators, indicators 1, 2, and 3. The first indicator is the number of new cases per capita. And as of last Thursday, we were at 111. And what the CDC guidance is for that, what they would like to see is that number not get above 50 for reference. Indicator 2, you can see over a 7-day average, there was an increase in cases, which we saw in the previous graph. And then the number of cases that are non-congregate, this has always been triggered in Washington County since the Public Health Advisory System started. This is just measuring the number of cases that are in congregate settings, in a prison or a hospital or a school, and versus ones that are just kind of caught out in the wild. And so the 100% of our cases are kind of caught out in the wild. They haven't recorded any congregate cases, at least within those time frames. So the way the system works is if one additional indicator were to trigger, Washington County could potentially go red or level 3. And those remaining indicators are the number of folks that visit the emergency room. Now this indicator is the least COVID specific indicator on the system. This is the number of folks that are going to the emergency room complaining of COVID-like symptoms. So it's not necessarily that they have tested positive, but they've gone to a doctor or they've gone to an urgent care and they've complained that they have COVID-like symptoms. And then indicator 5 is the number of outpatient visits, indicator 6 the number of hospital admissions, and indicator 7 ICU bed occupancy rates, which you can see have remained low. And we have never met indicator 5 or 6, and this is a 1, so not a lot of reason to be concerned in indicators 5 and 6 and 7, but certainly there are some things to be concerned about when you look at the number of cases, again, at the county level here in Washington County. So if you can see on the map here, we have an H, which means that at current we're a high incidence county because of the number of cases that are popping up per day. So that's what the Public Health Advisory System looks like. I want to talk about a couple of counties, though, before we leave this slide. The first county I want to talk about is Guernsey County. Guernsey County went red, I think, about 3 weeks ago, and the school district there decided, or the school districts there decided that they would maintain 5-day operation, despite the fact that they were red, because despite the fact that the county was seeing higher levels of cases, they were not seeing cases in the school district. And in fact, in 2 of the school districts, they had not received they had no cases in the schools, but they had still triggered red. So my understanding is those folks, despite being a level 3, have stayed in school 5 days a week. Another county I want to talk about is Monroe County, which is our neighbor just to the north. They are a yellow county. They are not even an orange county, but at least their experience has been a high number of cases, which you can see there's an H there in Monroe. And in their school system, I think as of last week, they had 11 cases in their schools and had had to quarantine over 100 students and staff there in the district. So Guernsey is a red county, yet they've seen very little spread in their schools. Monroe is a yellow county, but they have seen some spread in their schools. And then the third county I want to talk about is Meigs County. Meigs County was red at one point. I'm sure many of you probably remember that. But I'm happy to report that as of today, in the press conference with Mike DeWine, Meigs County is actually the lowest county for new cases right now in the state of Ohio. So despite having been a hot spot just a few weeks ago, The good folks down in Meigs County have done what they need to do and have made the changes and the decisions that they need to make as a community to drive that spread down, and have gone from one of the highest spreads to one of the lowest spreads in just a couple of weeks. Okay, this slide that you can see is also available at coronavirus.ohio.gov. This is updated weekly, and this provides folks with a listing of the number of COVID-19 cases that have been reported in schools. So you can see that many schools in Washington County have not reported any cases. The health department did report one case for Belpre City Schools, a student case, one new staff case, and one existing staff case at Marietta City, and so on and so forth. So I think the point of this slide, at least from my perspective, is to show that Washington County, as a county, has had a high number of cases, most of them coming out of the Marietta area. That Belpre has had some cases, but if you look at both Belpre City Schools and school systems across the county, we're seeing very low levels of spread in our schools, which is a great thing. It means that folks are wearing the mask in the school, they're trying to be socially distant. We are very, very grateful to many families that when your children get sick, you're keeping them at home. They're not coming to school. I can't tell you how many times I've had calls where parents have said, hey, we're just going to be really cautious here. We're going to keep our students home. We appreciate that because those little small steps, wearing the mask, being socially distant, keeping your kids at home, those are the kinds of things that when they combine, make real results for our school. So at this point, I'm going to stop for just a moment with killing you all at home with data. And I want to share some remarks that Governor DeWine made just last Thursday, about what he's seeing at schools and what he's thinking about schools across the state.
What I just said is all information that I think any Ohio citizen can get their hands on, can look at, whether you're a parent, whether you're a school administrator, just an average citizen. You just want to see what's going on in your county. Those are the two things we ask you to look at. Let's talk about our schools. I expressed the other day a concern, and a couple concerns. One, what is reflected in schools as far as COVID spread depends on what's going on in the community. If you've got 4 times the COVID spread, for example, you're in a rural county that's got that, you're almost bound to have some spread in your school. The schools, John, as you indicated, around the state, I believe, from all the information I can get, are doing a very good job. The indicators are that we are not seeing a significant amount of spread in the schools themselves. And it goes back to what I've said, what we've learned. What we've learned is when people are in a more formal setting, factory, workplace, school, people follow protocols and they wear masks, they try to keep a distance as much as possible, and you don't see a lot of spread generally. So that would be true with the schools as it will be for in business. Same way with colleges. In classroom, we don't have an indication there's much spread in the classroom. Spread in the dorms where the school can control the situation, there's some, but we're really seeing it spread throughout society. It's just people letting their guard down, the examples I gave earlier today, and just this social interaction and spread, people not wearing masks, not being careful, not keeping a distance. So I would ask our educators, I would ask our superintendents, take all of that into consideration, in the same way with parents. I think you also have to add the fact that while some students will thrive no matter how they're taught, it would seem, there are many students who don't. and there are students who don't thrive in a remote learning situation. And so we're now seeing some schools that were, went remote, of course, in spring. They've come back and were remote up until now. Some of them are announcing that they're going to stay remote at least until the end of this calendar year. And I would just say, look, we believe in local control. We believe in schools and parents making these decisions, but I'm bothered as the governor, frankly, by schools, by kids being out of school that long.
Okay. So those were Governor DeWine's remarks last Thursday during his press briefing, and as a superintendent, my takeaway from that is that it seems as if at a statewide level there is not as much concern, at least as of what the data we're seeing now, that it's spreading in classrooms between students and adults in schools, and he's been talking a lot about that difference between formal environments and informal environments. So when kids and adults are in school or they're in the workplace, they're complying with what they should do. But then it's in those private moments, it's when we're more informal on the weekend and our evenings that things are happening, and that is how it gets into schools, if it gets into a school, and not as much through transmission within the school. So I have spent the last week meeting with different parent groups. I had conversations with our employee unions and conversations with the board, our administrators, and different stakeholder groups as we've thought about where are we now and where we want to go from here. So we do have a couple announcements we're going to make tonight. The first announcement is that when we first started this back in August, we indicated that if Washington County were to go red, that we would automatically transfer into a hybrid environment where students would go to school Monday or Tuesday, one set of students, another set of students would go Thursday and Friday, with a day in the middle. That is going to be amended. So my recommendation to the board is that if Washington County were to go red, and hopefully we never go red, hopefully we do the kinds of things that we should do to stop that, but in the event that that did happen, my recommendation to the board is that they meet within 48 hours and that they look at the data they have, consult with our employees, consult with the public health director, and make a determination. But I just want to be upfront that on Thursday, for example, if we went red, but we were seeing the kinds of data that we see now, where there is a high incidence of cases, but there's a large percentage of them coming out of Marietta. We're not seeing a lot of spread in Belpre. I think there's every reason to believe that we would continue to do 5-day operation even if we went level 3 or red alert. At the same token, it could be that three weeks from now we're still orange and we have a high number of cases in the county and we've seen an influx in school, and even if we're not red, the recommendation may change the school district. So I just want to clarify that for everybody. We've learned a lot since August. When we all started our first town hall together, we had no idea what this was going to look like. But based on what we've learned since then, and based on what I'm seeing both locally at the state level, I feel comfortable that it's a very real possibility that if we were to go red, we could maintain 5-day operations safely. But again, it would be a meeting to determine that. So I want to also clarify and make sure everybody knows, I talk with Ann Boone, our public health director, at least weekly, and I've discussed this with her. She is very concerned about the level of cases in Washington County, but she is not as concerned about the local look of the virus here in Belpre. And so, that whatever she tells us holds great weight with us. But when I asked her, hey, if we made this kind of a shift based on the kind of data you're seeing now, could you support that? And she indicated that she could. But again, she also wanted to make sure that everybody understands that we are concerned with how things are looking at the county level rather, and we'll be monitoring it very closely. So that's the first announcement I want to make. The second announcement I want to make is we are going to add some additional custodial support at the elementary school. We just want to make sure with all those little kids that the buildings are clean and ready, so we will be posting that position. That's in addition to one other custodian that we have previously hired to augment our staff this year. And then just remind everybody that if you are an in-person learner and you want to go virtual, that's totally fine. You've had that right since the beginning. You continue to have that right. So if there are families tonight that have seen the data and are listening to what we're saying and feel concerned, or in the event that we do trigger a level 3 alert someday in the future, and you're concerned if we're going to stay 5-day, but your family feels like that's more risk than you would like, it's no problem. We will work with you and transition your family to virtual learning. So I just want to make sure everybody is tracking that. And then, our hope continues to be that in January we can reevaluate folks that chose virtual to bring you back in person. Our hope, as we stated previously, was to send that survey out in December and make those kinds of decisions. But I also just want to point out that it continues to be in flux as we look at what the cases look like and what's happening in our community. But as of today, that's still our intent, but that's subject to how things are going and what the risk levels look like. So, I don't want to be the bearer of bad news tonight. I cannot say enough how grateful I am for what everybody's doing at our local level, but I do want to be upfront with everybody and transparent about what it's looking like at the county level and what some of the concerns that I have about what's going on around us. But the good news, at least for Belpre for now, is that things are going very well. And I think it's incumbent on all of us to do the small things each and every day to make the right choices so that we're not putting our families or our students in a pathway where they might pick this thing up and bring it into the schools. Governor DeWine said this morning, he said, quote, if you live in a high incidence county, which Washington County is one, he said, please reconsider hosting or attending gatherings of any size, including with friends or extended families, anyone outside of your household. Think about canceling events. Certainly don't go to a Halloween party, and please stay home if you are ill. And I think that's been his message to Ohio, is it's these non-formal settings where folks aren't at school or not in the workplace where we feel more relaxed, or we have some kind of gathering because it's been so long since we've had those kind of things. The Buckeyes played on Saturday. And I think he's just pleading with us all to just maybe have a little bit more boring of a winter and continue to make conservative choices so that we can control the spread and we can keep running and we can keep our kids in 5 days a week. Because like the governor, I worry about what that would look like. It was one thing to do it from March to May. It's another whole story from now indefinitely. And we've been doing great. Let's keep it up. And let's make the right choices we need to make. So those are my announcements. That's the data. Now I'm looking to the folks in the room to see what questions you might have. If you have a question, please go ahead and write it in the chat area on YouTube or Facebook, and we'll answer them.
Okay, positive feedback so far. A lot of our parents are thankful for the opportunity to keep the children in school for 5 days, especially with the low numbers that we have across the county in our school districts, so in our buildings. One parent did ask for some clarification if you could share what the numbers are specifically in Belpre. So there's worry in Marietta.
Yes. So I asked for that information from the health department, but they are busy contact tracing with a number of new cases, so I did not hear back. I think the last I heard last week that there were 69 active cases across the county, and that there were maybe 8 to 10 cases in Belpre, and the rest coming out of the Marietta area. That was it. I don't want to, if Anne's watching this, she might think, well, that's not right, but that's what I recall. And that's why I said about 90% of the cases are coming out of Marietta from kind of that shoot from the hip stat I got last week. If we do get updated numbers from the health department, we can provide those.
Okay, a couple of questions going along with our virtual academy. So on both sides of the spectrum, will virtual academy continue through the rest of the school year?
Yeah, so I don't have any reason to doubt that that's the case. Yeah, I don't, unless things dramatically improve, but I don't see that happening the next 2 months. So I think virtual families should feel very secure that we will continue to have that option through the rest of the academic year, for sure.
Okay. Is there anything special that parents need to do if they want their child to come back in person next semester?
Yeah, so look for a survey in December. If we're able to accommodate that and have that shift, which again, sitting here today, we hope that that's the case, we will send a survey out to those folks in early December where they can make that election.
Okay. Also, going back to the numbers question in Belpre, and you showed the screenshot of the numbers from each school, but just for clarity, what is the number for Belpre City Schools? How many cases have we had?
So we have reported, or the Belpre Marietta Health Department has reported one student case here in Belpre City Schools.
Okay. After taking an opportunity to meet with all the various groups, one parent would like to know how our staff members are feeling. What was the feedback that you got from them?
Yeah, so we employ a lot of staff members, so it's always there's always going to be folks on both sides, but we had a big all-staff meeting yesterday, and from my perspective, I gave these same statistics and spoke with them, and I think we continue to think and believe strongly as a group that given what we know about the virus, given our current conditions, that they were comfortable with me making this recommendation to the board. They are very concerned about the impact on kids, both academically and social emotionally, if we cannot continue 5-day operations, and that I think they understand where we are for now and what we're looking at, and are comfortable with that recommendation. But again, my commitment to them has always been that we will listen to them and we will be transparent with them, and that they have a seat at the table to determine what operations look like. So thank you for that, and please thank your teachers. It's an unbelievable amount of stress, and the virtual teachers have been wonderful, and they're just reinventing the wheel. It's a very difficult year, and so please, if you have the chance, thank a teacher, and they're true heroes. And that goes from our teaching staff down to our support staff. So bus drivers, custodians, cooks, everybody. It's just working. You should see the cooks. They pack individual pizzas in trays so kids can eat in their schoolrooms. Bus drivers continue to work through it all. It's been humbling to lead a team that's been so committed to kids, and that's where we stand on that front.
So one question that we have about the chance that we would have to go back into a virtual learning environment for our whole school, would our students have Belpre City Schools teachers in the event of that happening?
Yes. Yeah, the question was if we went virtual, would we have our teachers do it? Yes. Yeah, at that point we would. Some of that timing might, for the folks that are 7-12, may change. For example, if we had to go mid-semester, we would have to evaluate if we could switch that off, but our intent is yes. We would continue to provide that for at least the kids that are in person, and if possible, if folks that are at Blue Sky or on Peak would like to become part of that as well, that we could do that. So yes.
We'd like to note too that there's lots of positive feedback about the hard work that our staff has put in. So lots of parents are saying wonderful things about our teachers and our staff members, and we're just thankful to hear that. So one question we do have is about, there is some question about mask breaks across our school buildings. So are students getting them? Is that still something that we're able to offer given the circumstance?
Yes, so mask breaks are still occurring. Folks are off. That's an individual teacher level decision. Our guidance from the health department has been that they cannot be any more than 15 minutes in length. And I popped in classes where there's a mask break going on, and then I popped in classes when they're engaged. So that's I believe still something that our teachers are providing, but again, that's their decision in their classroom. It's not something that we control, but it's still happening, and I foresee that it will continue to happen.
Also, just some nice feedback on our virtual learning and those environments as well. So we're thankful for the feedback we're getting from our parents on Facebook right now talking about the virtual learning environment. They seem very happy with that.
Great.
Yep. We do have one question that is kind of a large-scale question, so zooming out a little bit. The FDA has banned several types of hand sanitizers. We've seen a list. Are we checking those brands that we have in our buildings?
Yeah, so our Director of Maintenance and Transportation, Scott True, has worked very closely with our vendor, Highland, to make sure that we are on the cutting edge of what that is. So from what we've indicated, from what we have been told, our product continues to be one that is certified to properly cleanse for the virus. And if that changes, we'll change our solution.
We have a building full of elementary students who are delighted to get to use hand sanitizer anytime they want to. So they're very happy with it. Okay, so we are just getting lots of great feedback about the town hall meetings and about our school process right now. We are out of questions at this point.
YouTubers, any questions? Okay. All right. Well, hey, we appreciate the time. It was a quick 30 minutes, at least on my end. If you have any other questions, please feel free to reach out to me via email or call to the superintendent's office, and we will continue to engage and communicate with you. And as we start seeing any changes, if we need to alert you to what we're thinking, what's going on, we won't hesitate to do so through these channels. So again, thank you so much for a great night, and we're looking forward to more school soon. Take care.